In this short video, we will show you what patients with headache and posterior cervical pain need to do at home to support therapist efforts in building up clinical response. At the same time, the patients who are on their own can use the same stretching routine as a preventive measure in the future, or if they don't have access to medical massage therapy, the application of this simple set of homework allows them better control intensity of discomfort in the form of the headache, posterior cervical pain, or pain in the upper shoulder. My name is Dr. Turchaninov. I am founder of Science of Massage Institute, and as I said, we will discuss right now how to apply homework for the patients with headache and posterior cervical and upper shoulder pain to avoid side effects and enhance treatment options. This is a very critical aspect of the therapy because therapists need to have support at home to not lose previously achieved results. So from that perspective, patient responsible 50% for delivering clinical outcome. Therapist does his or her 50%, while the patient invests in exactly same 50% by doing homework. Combining both 50%, that's what gives 100% deliverance. That allows therapists move from session to session quicker with stable outcome. Just one particular reason, the therapist and the patient work together to control abnormality and restore normal function. Okay, we will ask our director of service for the assistance. The first stretch requires 3-step preparation. Step number 1, ask patient to drop the head. Step number 2, put hands behind the head. Step number 3, very critically important, relax neck and shoulders. Now force of gravity, take everything down. Weight of the hands, weight of the head, force of gravity, weight of the shoulders, everything right now slightly pushes head forward, stretching posterior neck. Now, patient inhales quickly and exhale slowly and using only palms. Exhaling slowly, gently pushing head down using only palms. Now, mistakes. Patient will do first that. Use upper arms and shoulder. Don't do that. Number 2, they will try to bend in the chest to go like this. Don't do that. Thirdly, when they inhale, they tilt head backward. Don't do that either. Posterior cervical muscles need to be completely deactivated. In this position, quick inhalation and slow exhalation through the compressed lips. Inhale. Exhale. That's the first stretch. Second stretch, it starts the same way. Head, arms, relax shoulders. Now inhale. Hands slightly pushing down, and now gentle rotation. This rotation is not happening because cervical muscles. Incorrect application will be inhale, exhale. You see how far she turns her chin? Because she uses her posterior cervical muscles, which you cannot stretch while they're working. So we need to completely deactivate them and use only palms to do that. Inhale, exhale gently forward and add rotation. Let's see how Julia does that from the posterior view. So she inhales, gently pushes head down first, and then interlock fingers. So you can see clearly that interlocking of the fingers gives her rotation to the left. Now she releases pressure, inhale, goes down, and then interferes and turns her head to the right using her hands, not engaging posterior cervical muscle. Last, third stretch, we will show you application on the left side. To do it right, we ask Julia to put forearm on top of the head, with 2 fingers grab ear and mastoid process, which is bone below the ear, then relax neck. She inhales and she uses her hand to tilt gently her head to the right. Then again inhale and gently during long exhalation to the right. Mistake. Patients will have tendency to put hand behind the head, and then during the stretch, head will go forward. Lateral flexion can be only with this application when the forearm on the top of the head. Now she inhales and gently tilts to the right. If you want to decisively help patients in complex clinical cases, greatly increase your income, and partner with local medical communities, please click right now at the link below in description and join us for live medical massage seminars and webinars, and we will work together. Thank you and see you in the future. Each stretch, and it doesn't matter, it's stretch patient does or therapists do it passively. Each stretch needs to be done during long exhalation, actually prolonged exhalation, because each inhalation activates motor cortex, even quiet inhalation, activate our motor cortex in a way that it slightly increases resting muscle tone in all muscles in human body. So you're using longer exhalation as a tool to additionally reinforce passive stretch done by the therapist or by the patient themselves. From that point of view, without proper respiration, that doesn't work. The simple way I suggest to my patients is very simple visual. Imagine that you will like blown balloon for the child. What you will do? You will get a lot of air, am I right? And then compress slightly lips, small opening, and each exhalation needs to be finished with no air left in the lungs. That gives you optimal decompression of the soft tissue during passive stretch. And it doesn't matter if it's done by the therapist or by the patient themselves. There is one more stretch which used specifically after these 3 applied. If the patient has anterior scalene muscle syndrome, then we will use additional stretch at the very end of the session after going forward to the right, forward to the left, and lateral flexion. Now, there is one specific stretch used only to isolate anterior scalene muscle in the case of anterior scalene muscle syndrome or thoracic outlet. For these specific scenarios, you need to have stretch will decompress anterior neck, not the posterior neck. But you cannot decompress anterior neck without decompression posterior neck. From that point of view, first stretch is what you saw, used on all patients with posterior cervical pain and headache and shoulder pain. But if the patient has anterior scalene muscle syndrome, after those stretches, one extra stretch needs to be done. For anterior scalene muscle, we will do it on the right anterior scalene muscle. We ask patient to turn to the left, stabilize right shoulder, clench the teeth, and then bring head to the shoulder, ear to the shoulder. That gives you pressure above the clavicle. That isolates anterior scalene muscle. Let's do it during exhalation. Inhale, long exhalation, and teeth. Great. Mistakes. If the patient is not compressing the teeth, turn to the right and drop the lower jaw. Then the lower jaw is not pulling anterior scalene muscle. So teeth need to be compressed together. And there is another aspect. So now look, turn to the left, and then patient will do this. You would like them to do that. That gives you anterior scalene pressure on the right. All of them will do this. That will not isolate anterior scalene muscle. So rotation, stabilization of the shoulder, clenching the teeth, and that's the stretch. Patient need to repeat 5 times each stretch during 5 longer exhalations. Head going forward 5 times, head going forward to the right 5 times, head going forward to the left 5 times, and 5 times lateral flexion only on affected side if it's unilateral pathology. Same way for anterior scaleral muscle. You don't want to do at the beginning both sides, you would like to concentrate on the affected, but each stretch needs to be repeating 5 times to get a clinical outcome. Thank you for watching, thank you for assisting, and I hope you enjoyed and learned some important clinical tips which you recommend to your patients. You have to be sure that they're doing that right, and during the next session you have to be sure that you check how they're doing that. You ask them, show me what I showed you last time. I actually ask my older patients to make video of me doing that they have guide. But technically speaking, you can suggest them to see this video in the future, which allow them to do it correctly. I hope you enjoyed video. Let's work together to bring your practice to the new level of medical massage application. Thank you. See you next time.